So we're going to do hand rejuvenation, and we're going to use a product called Radiesse. And I have already mixed the product with some lidocaine, make it a little more comfortable. And this is just some rubbing alcohol that we're putting on the skin, get everything ready. And then we're going to let that sit for just a second, maybe a little too much. In some places there is such a thing as too much alcohol. It's good vapors opening up the sinuses, that's great. Okay, and then we're just going to use a nice skinny needle. And I'm going to pinch the skin, if you can see that. We're going to pinch the skin. I'm going to hold it up. I'm going to get the tip of the needle in. I'm going to wiggle it, make sure we're not in a tendon or a vessel or anything. And I'm going to give a little bit of the medicine. I'm going to turn so I can see how much. And then we're just going to put this in. And it kind of goes in. And this is the depot way of doing it. There's a couple different ways. We're going to move next. Same thing, wiggle, wiggle, wiggle. I'm going to give a little more. There we go. Dun, dun, dun. Okay. Over here, wiggle, wiggle, wiggle. So far so good, I'm not hurting you?
Not hurting me.
Outstanding. There, you heard it. You heard it here first. Okay. I'm going to come over here in the first space. So before we even begin injecting, we have the patient wash their hands for a good 2-3 minutes, just a really thorough wash. I'm going to put a little bit in this space. It looks like I could use a little touch more. Wiggle, wiggle, wiggle. Not in the tendon, not in any place important. And then we just massage for a little bit. Sometimes it helps to have a little extra liquid. So we'll put some of this alcohol, just so everything glides. Almost sound like Bob Ross doing injections, good Lord. But I clearly don't have the hair, unfortunately. Okay, that is hand injections. And so the aftercare is she's going to sit on her hands for a few minutes, and then for the next 24 hours, we're not going to do heavy activity, and we're not going to wear jewelry or rings, anything that could constrict, because the swelling can be intense at times. But after that, we're back to doing everything we want to do. Thanks.